everyone, good morning. This is Maria Teresa P. Alata from Bachelor of Science in Nursing, Section 1A6. And today I will be conducting Musculoskeletal Assessment. So Musculoskeletal Assessment provides information regarding the posture, gait, the bone structure, the muscle strength, and the joint mobility of the patient, as well as the client's ability to perform activity of daily living. So my patient for today's procedure is my sister, Christine Marie P. Alota. And since this assessment is showing some body parts, so I already got her consent, as well as I already got the consent of my mother and father that I will be using her as my patient for today. And as for the procedure, I already instruct her what must be the things that she must do as I perform the procedure. Prior to the conduct of the procedure, we must prepare the necessary equipment for this assessment to conserve time and energy, and also check the health history of the patient for previous conditions. Hello ma'am, good morning. I am Maria Teresa P. Alata, your student nurse for today, and I am from Southwestern University, FENMA. Okay, can I have your wristband, ma'am? Kindly state your name.
My name is Christine Marie P. Alata.
And your birthday, please?
December 27, 2006.
Okay, so how do you want me to address you, ma'am?
You can call me Christine.
So the assessment that I will be doing today is the musculoskeletal assessment, in which I'm going to get information about your gait, your posture, your bone structure, your muscle strength, as well as your joint mobility. So this kind of assessment requires several different position changes, but you don't have to worry since I will give you enough time to rest, okay? Next, after explaining the procedure to the patient, make sure to observe proper hand hygiene and observe privacy to the patient, and adjust the room temperature for the comfort of the patient. So I will just wash my hands and I will be back, okay? Okay, we can now proceed to the procedure. Okay, the very first thing that we need to do is to assess the gait, the posture, and the balance of the patient. By doing this, have the patient stand. Okay, ma'am, can you please stand? So in assessing the gait, the posture, and the balance of the patient, have the patient stand, and then observe the posture. Can you please move your feet together? Okay, like that, and stand straight and properly. So far, the posture of the patient is erect and her weight is distributed evenly. And can you please walk, ma'am? And go back. Okay, thank you. So, as the patient is walking, her hand is swinging in opposition, which is good. And can you please move here a little bit? And stand on your toes. And down. And can you please stand with your heels? Okay, down. The patient can able to stand on their toes and on her heels. Next, assess the wrist for falling of the patient. Okay, stand behind the patient and put your arms around there, and then nudge. We're going to assess the nudge test. Nudge gently the sternum of the patient. Okay, so far the patient doesn't fall backward, which is a good sign. Next, assess the temporomandibular joints of the patient. Okay, ma'am, can you please open your mouth? Close. Open again. Close. Okay, so far I don't feel any tenderness or any swelling on the temporomandibular. So the patient can open her mouth smoothly. And next, ma'am, can you please move your jaw side to side? Okay, so the jaw move 1 to 2 centimeters, which is a good sign. And I'm going now to protrude and retract your jaw. So do you feel any pain? How about this? Okay, so the patient doesn't feel any pain. And as I protrude and retract, the jaw of the patient. It contracts, which is normal. Okay, ma'am, can you please open your mouth? And I'm going to place my hand, and you will need to push it against resistance, okay? Go. And the other one. Okay, so far, the jaw has a range of motion against resistance. Can you please clench your teeth? Okay, so I'm going to create your masseter and your temporal muscle. Clench. Okay, so do you feel any pain? Okay, no tenderness present. And next, assist for the sternoclavicular joint. So inspect if there are any swelling. Can you please sit properly now? Okay, like that, thank you. And then inspect for any discoloration, the location of the joint. So it is properly located on the midline. And then palpate the area for tenderness and pain. Do you feel any pain here, ma'am?
No.
Okay, that's good. Proceeding now to inspecting and palpating the cervical, the thoracic, and the lumbar spine. Okay, ma'am, can you please sit properly? Okay, relax your hand there. And face there, ma'am. Okay. Okay, sit properly. Okay, like that. So inspect the cervical spine and the thoracic spine and the lumbar spine. Make sure that the cervical and the lumbar spine are concave. So concave, like that. And make sure that the thoracic spine is convex, which is like that. Okay. So I see a normal. So it is normal. And then make sure to check the shoulder, the height of the shoulder, if it is symmetric. And also check the crest, the iliac crest, if it is symmetric, as well as the buttocks. Okay, next, the range of motion of the cervical spine. Okay, right now, ma'am, I'm going to assist the range of motion of your cervical spine. So can you please touch your chin and your chest? Okay, so can you please chin up as far as you can? Okay, then can you please move your head from the side? From the side. And also, can you please touch your ears from your shoulders? Like that. The other one. Okay, can you please rotate your head? Okay, that's good. Thank you so much. So far, the patient can perform the movement at the normal range of motion. And next, assess the range of motion for the thoracic and the lumbar spine. Okay, can you please, ma'am, bend over and touch your toes? Okay. And also make sure to inspect or observe the symmetry of the hips, the scapulae, and the shoulder of the patient. Okay, can you please move from side to side, then side, the other side. Okay, can you hyperextend your back? Okay, thank you. And can you please rotate your body away from your hand? Place your body like that. Okay, the other one. Okay, thank you. So the patient performed the movement at normal range of motion. Next, test for back and leg pain. Okay, ma'am, so do you feel any pain in your leg or in your back?
No.
Okay, so I'm going to raise your leg at the 90 degrees. So if you feel any pain, please verbalize it, okay? Okay. Okay. Do you feel any pain?
No.
Okay, the other one. Okay, so do you feel any pain?
No.
Okay, so it is normal to have or to feel pain in your hamstring when you raise your leg at the 90 degrees. Okay. Next, assess the leg length of the patient. Okay, 84 centimeter. Okay, 84 centimeter. So far, the length or the leg length of the patient is equal, because there are some cases that the leg length is unequal due to scoliosis. So now we are down to inspecting and palpating the upper extremities. Okay, so right now, ma'am, I'm going to inspect and palpate your upper extremities. That includes your shoulders down to your fingers of your hand. Okay, let's start with your clavicle. Okay, inspect for any masses, any swelling on the area, and also if the bone is symmetric on this area. And then inspect the shoulder, make sure that it is equal in height or symmetric. And then the scapula also. So observe for any bone conditions such as scoliosis. And then inspect the arm for any lesions or discoloration. Inspect for any heat that may indicate inflammation. And then inspect the wrist as well as the hand along with the finger. Okay, the other one now, please. Observe or inspect for any bruises. Okay, so far it is normal. And then we're going to palpate, starting from the clavicle. So do you feel any tenderness here, ma'am? No. How about pain? No. Okay, so make sure that the shoulder is evenly rounded. Okay, that's good. And the scapulae. Do you feel any pain here, ma'am? Okay, good. And then palpate the arm. Palpate for any edema if there are. Okay, no edema. So do you feel any pain here, ma'am? Okay. So here. And then palpate the brachial artery pulse. It's pulsating normal. Then palpate the wrist. Palpate for any nodules present. Okay, no nodules. It is non-tender also. And then palpate the hand. Here, ma'am, do you feel any pain? Wala. Okay. And the finger. Okay, do you feel any pain, ma'am? Okay, that's good. And then palpate for the capillary refill of the fingers. Okay. Okay, so far it is normal. How about the other one? No? Do you feel any pain here?
No.
Tenderness? Okay. Palpate for any masses also. Capillary feel. Okay, it's normal. So the muscle is fully developed and I don't see any tenderness or any nodules on the upper extremities. Now proceed to the testing the range of motion. Can you please stand up, ma'am? Okay, can you please raise your hand and then sway it at the back. Okay, adduct your hand, then abduct, and then put it over your head like that. Okay, thank you. Bring it back. And then now test for the range of motion of the elbows. Can you please move your hand on behind your head like that? Okay, and then behind your back like that. So can you please move it another like that? Okay, so do you feel any pain? Okay, put it back. So far, the patient can perform the movement at a normal range of motion. Next, test the range of motion for the elbows. Okay, ma'am, can you please flex your elbow like that? Okay, extend your elbow. Stand. Okay, thank you. Okay, can you please put your hand at the center and face your palm upward. Bring it back to the center and face your palm downward. And bring it back to the center. Okay, thank you. Put it back. So the patient can perform all the movements at a normal range of motion. Okay, you can now sit down. Next, test the range of motion for the wrist. Okay, can I have your wrist now? Okay, can you please make a fist and rotate? Rotate like that. Okay, thank you. And then, okay, can you please move your hand in the air? And then flex your wrist, hyperextend it, and then rotate. Okay, thank you. Right back. So the patient can do all the movements at a normal range of motion. Next, test the range of motion for the hands and the fingers. Okay, ma'am. Can you please move your hand again on the air? And then can you please flex your fingers? Like that. Hyperextend. Okay. So, can you please close your hands? And then open it again. And then face your palm upward. And then abduct your hands or fingers. And then put it back again to abduction. Okay. So using the base of your, using your thumb, touch the base of the last finger. Okay. Good. And then using your thumb, touch each tip of the fingers. Okay. Back. Another. Okay, that's good. Thank you. And how about the other one? Okay. Can you please touch the thumb on the base of the last finger? Okay, very good. Thank you. So far, the patient can do all the movements at the normal range of motion. Now, assess the range of motion of the hips. Okay, can you please raise your leg, ma'am? Okay, the other one. Okay, down. And can you please extend the knee? Extend your knee upward, like that. Down. And the other one. Okay, down. Okay, can you please abduct and adduct your leg? First, abduct. Okay, so abduct. Abduct again. And abduct. Okay, thank you. Can you please extend your knee straight and then rotate it internally and externally? Okay, thank you. The patient can perform the movement in normal range of motion. Next, inspect and palpate for the knees. Okay, inspect for any discoloration, any swelling or edema. And also inspect for any rashes or lesions. And if rashes or lesions are present, make sure to record or document the shape, the size, and the characteristic of that lesion or rashes. And so, no rashes or discoloration occurred. Also, inspect for any heat. So now palpate the area. So palpate for any tenderness. Do you feel any pain here, ma'am?
No.
Okay, how about here?
No.
Okay. So, palpate for any heat. If you feel any heat that may cause inflammation. Okay, so palpate for edema. Okay, no edema present. And then palpate the popliteal artery that is located at the back of the knee. So it is pulsating normal. How about the other one? Okay. Next, test for ballottement test. Okay, so using your thumb and your index finger, place it on the side, each side of the patella. And then using your dominant hand, tap the patella. So observe for any fluid wave or click. Okay, so far I don't feel any fluid wave or click here. So it indicates that the patella is rest firmly on the femur. Next, test the range of motion for the knees. Okay, can you please flex your knees, ma'am? Okay, down. Hyperextend. Okay. How about the other one? Flex and then hyperextend. Okay, that's good. Thank you very much. Next, inspect for the ankle and the feet. Inspect for any discoloration, deformities, swelling or edema, any rashes or lesions. So do you have problem with your feet recently, ma'am?
No.
Okay, that's good. And then palpate the feet and the ankle. So do you feel any tenderness or pain here, ma'am?
No.
Okay, so how about here?
No.
Here?
No.
The other one? Okay, here?
No.
So do you feel tenderness here?
No.
So inspect or palpate for any noodles or tenderness. And then palpate the two poles that is located on the feet, which is the dorsalis pedis, it is located on the dorsum, and the posterior tibial artery poles. Okay. Okay, it is pulsating normal. Okay, the posterior tibial. Okay. Okay, that's good. Thank you, ma'am. Next, test the range of motion of the ankle and feet. Okay, can you please point your toes upward? And then downward. Okay, so can you please turn your soles outward? And then inward. How about the other one? Okay. And then your soles outward and inward. Okay, very good. And then rotate your foot outward. Rotate your foot outward. And then inward. Okay, very good. And turn toes underfoot. And then upward. How about the other one? Outward. Okay. So far, the patient can do all the movements at a normal range of motion. So that's the end for the musculoskeletal assessment. Okay, ma'am. Thank you very much for your time and for your cooperation for today's assessment.
Thank you.
So, rest assured that all the information that I have gathered a while ago will be kept confidential and will be handed safely to your physician. Okay? Okay, so if you need anything, don't hesitate to press that call button so that we can assist you right away. Okay? Okay, so thank you, ma'am.
Thank you.
So right after that, we need to observe proper hand hygiene.